Across Europe, a quiet but profound change is underway. Mosquitoes are thriving, and with them, new health threats are emerging. Once considered a minor nuisance, these tiny insects are now at the forefront of a growing public health concern as their populations surge in places where they were once rare. Diseases once limited to tropical regions like chikungunya and West Nile virus are now appearing in our own backyards. The line between distant outbreaks and local emergencies is blurring as cases are reported in communities that never expected to face such threats. This isn't a one-off event, it's a trend driven by climate change. Warmer temperatures and shifting weather patterns are creating ideal conditions for mosquitoes to breed and survive throughout the year. The European Centre for Disease Prevention and Control warns that record outbreaks are becoming the new normal. Surveillance teams are tracking the spread of these diseases with increasing urgency as the risk grows each season. Longer, hotter summers and milder winters are extending mosquito breeding seasons, allowing them to spread further and faster. Stagnant water in urban and rural areas alike becomes a breeding ground, making it harder to control their numbers. The rhythm of European seasons is shifting, favoring mosquitoes and the diseases they carry. Spring arrives earlier, autumn lingers longer, and the window for mosquito activity widens with every passing year. Our natural defenses are weakening, and regions once safe are now vulnerable. Even areas that prided themselves on cool mosquito-free summers are seeing these insects establish a foothold. Health experts urge vigilance. Europe is no longer immune to these outbreaks. Public health campaigns are ramping up, emphasizing prevention and early detection to limit the impact of these diseases. Rising temperatures are now a public health issue, not just an environmental one. Hospitals and clinics are preparing for new challenges as heat waves and mosquito-borne illnesses become intertwined. The familiar buzz of a mosquito now signals a new reality for Europe. What was once a harmless sound of summer evenings now carries a warning of potential danger. We must adapt to this warning and prepare for a future where mosquito-borne diseases are part of our lives. By taking action now, we can protect our communities and build resilience against the challenges of a warmer, changing Europe. The surge in mosquitoes isn't just a seasonal nuisance, it's a global phenomenon that's rapidly intensifying. This explosion in mosquito numbers is directly linked to climate change, which is transforming environments all over the world. Warmer temperatures speed up mosquito life cycles, allowing them to breed more frequently and survive for longer periods than ever before. Heat waves and unpredictable rainfall create perfect breeding grounds. Stagnant water collects in everyday places, from city parks to backyard containers, giving mosquitoes more opportunities to multiply. Milder winters mean more mosquitoes survive until spring, so each year their populations start off higher and grow even faster. The tiger mosquito, once confined to tropical regions, is now spreading northward as cold winters disappear, bringing new health risks to places that never faced them before. These changes are predictable responses to a warming climate, and scientists have warned about them for years. As natural barriers vanish, mosquitoes are moving into new territories, adapting quickly to both rural and urban environments. Disease transmission seasons are now longer, and outbreaks of mosquito-borne illnesses are becoming more frequent and severe. The health of our planet and our people are tightly connected, and the rise in mosquitoes is a warning sign we can't ignore. The growing mosquito population is a clear symptom of a planet in distress, urging us to take action for both environmental and public health. Mosquito-borne diseases are no longer a distant threat. They're here, affecting communities across Europe in ways never seen before. What was once a seasonal nuisance is now a year-round concern, as mosquitoes adapt and thrive in new environments. Chikungunya, spread by the invasive tiger mosquito, has surged across 16 European countries with outbreaks rising sharply in just a decade. This rapid expansion is alarming scientists and public health officials alike. France and Italy have reported locally acquired cases, including the first ever in Alsace, signaling a northward spread. These cases are no longer isolated incidents. They're becoming part of a troubling new pattern. West Nile virus is also surging, with hundreds of cases and multiple deaths reported this year. Hospitals and health workers are on high alert, bracing for further outbreaks as the season progresses. New regions in Italy and Romania are seeing their first cases ever, highlighting how quickly these viruses can move into previously unaffected areas. Once mosquitoes establish themselves, these diseases can quickly become endemic, making eradication far more difficult and costly for local communities. Each new case marks the collapse of old climatic barriers. Warmer temperatures and changing rainfall patterns are creating ideal breeding grounds for mosquitoes. The spread of these viruses is turning climate warnings into real public health crises, forcing Europe to confront a new and urgent reality. Europe's mosquito problem is part of a global crisis. Mosquito-borne diseases kill around 1 million people and infect hundreds of millions worldwide each year. Explosive outbreaks in China and surges in dengue across 94 countries show how quickly these viruses can spread. Global travel and climate change mean diseases can arrive anywhere, anytime. An infected traveler and a single mosquito can spark a local outbreak. Europe's struggle is part of a worldwide fight against an adaptable enemy. The boundaries that once contained these diseases are fading fast. The only way forward is united action across Europe. Mosquito-borne diseases demand a coordinated continent-wide response. Enhanced surveillance, real-time data sharing, and early warning systems are essential. Public awareness and simple prevention, like removing stagnant water, can make a big difference. Healthcare workers must be trained to spot and treat these diseases quickly. Tackling climate change is crucial to address the root cause. The health of people and the planet are inseparable. By working together, we can turn this challenge into an opportunity for a safer, healthier future.